Hello, my name is Amber Florian, and this is my population level health education intervention presentation, Nurse 447. Introduction. The underserved population for my health intervention are from the 95116 area of San Jose, California. I chose to do my education classes at the Eastside Community Senior Center. The four health problems I identified were high blood pressure and cholesterol, overweight and obesity, diabetes management, and tobacco use. Background and significance. Epidemiologic data. So in this area, 65% are Latino and 24% are Asian Pacific Islanders. They have high rates of obesity in adults than other who lives in the same county. And there is a high death rate from diabetes, about 42%, and hypertension, 22% in this community than others. Median household income is about $51,000, and there is a small percentage of adults earned a bachelor degree or higher. From my windshield survey, I observed litter of cigarette butts, so there is evidence of smoking, obesity, fast food was readily available, and more cars and buses fill the streets than people walking. Significance, this community could benefit from education that focus on healthy nutrition and healthy lifestyles, such as being active and smoking cessation. Which could help address multiple chronic problems such as hypertension, diabetes, and obesity. The next slide talks about Healthy People 2020 objectives. So those two aim to reduce all four problems I have mentioned before, including cardiovascular disease, such as hypertension and high cholesterol, obesity, diabetes, by promoting healthful diet, smoking cessation, and increase awareness of healthier lifestyles. So the heart disease and stroke state that improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke, early identification and treatment of heart attacks and stroke, prevention of repeat cardiovascular events, and reduction in death from cardiovascular disease. So I was sure in my booklet for hypertension to add some information related to stroke and high blood pressure. And the second objective is nutrition and weight status, state that to promote health and reduce chronic disease risk through the consumption of healthful diets and achievements and maintenance of healthy body weights. And that's taken from Healthy People webpage. The next slide is needs assessment. So during my windshield survey, which was the first step, I identified the health issues as well as by researching data from the Santa Clara County webpage, which revealed the top 3 causes of death were cancer, cardiovascular disease, and diabetes. I then consulted with my clinical facilitator regarding the intervention location. And once I found the location, I made a visit and an appointment to speak with the program coordinator. And then when asked her what are the prevalence health issues among the seniors, she replied that mostly we see hypertension and diabetes across the board. And the next slide talks about the theoretical framework and needs assessment. Sorry, I'm going to move myself right here, which I use the precede proceed model. It comprised of 8 phases that help us health providers to develop interventions in order to address a health or community issue. So in this, I started the needs assessment, identify what goals the community wants to work on, achieved by doing direct interviews and observation from the windshield survey, as well as relying on the county data for causes of death in the targeted community, as I mentioned before. The second phase is to target behavioral, lifestyle, and environmental factors or barriers. The third is to identify factors that can influence behavior change. Then to look into organizational issues. then to implement, to do my interventions, then process evaluation, impact evaluation, and outcome evaluation, where I basically assess and measure my long-term goals and my short-term goals. The next slide talks about the issues, education and practice. So barriers that can prevent outcome achievement. The first barrier was language and educational barriers. According to the Santa Clara County webpage, it shows that 49% of the adults in this community are foreign born, 80% speaks a language other than English, and 37% have less than high school education. They had easy access to unhealthy or fast food options, limited access to farmers markets. There was no calorie or carb count for served meals at the senior center, and most seniors rely on family and public transportation. Assets that can promote outcome achievement. So there were nearby public parks, and that's good for physical activity. 16% of the household received CalFresh benefits. So that's something, to help them get the nutrition that they need. And community centers that offer free meals, such as the one I volunteered in. And the needs of the community to make lifestyle modifications. So the first thing is that you need to have a good desire to change. Second, information, education on how specific health problems are caused by poor lifestyle choices or imbalanced diet and lack of physical activity. Information should be in a language the population can understand. And also, it's good to have good resources, such as adequate support system. Could be from friends, caregiver, family, that can help you with the active daily living and transportation. Free health screening at the senior center, and social services such as CalFresh and the Supplemental Nutrition Assistant Program. The next slide, it talks about the actual interventions I did. So I stated, again, the Healthy People 2020 objectives, which are basically my long-term goals. And the proposed interventions, providing 2 educational classes regarding hypertension, which was my chronic disease that I chose, and healthy nutrition management. Set up date, time for the 2 classes. Distribute flyers at the beginning of week 7 to notify the seniors and staff regarding class on Friday. Invite a few seniors at a time to receive blood pressure checks and diabetes screening. I had to assess prior knowledge to see what they know, and then review the booklet content together with them. And then give them some time for questions and answers, and also assess their learning through the teach back method. The idea was to create small groups of about 2 to 3 seniors at a time, or one-on-one education, just depends on how many seniors arrived to my table. I would offer them infographics and colorful handouts that are appropriate for level of education and match their language. So I had to print in English, Spanish, and Chinese. And the budget, so that includes the community center was able to provide blood pressure machines, but they did not have colorful handouts. I needed to spend my own money on prints and time to bind all the paperwork together. So I used my own money to for when I wanted to buy some incentives, such as fresh fruits and stress-free bowls. The community center had a few volunteers that did speak Spanish and Chinese. As I work nights, I had to assure that my free day, the night before the class, transportation to the community center. I needed to submit a recent TB test prior to volunteering, and I had to setting up the date and time required back and forth emailing with the program coordinator. So I had to be on top of that communication aspect. So project evaluation and outcome measurement. Hypertension prevention class, I had 2 short-term goals. The first one was by the end of the class, at least 50% of the participants will be able to state at least 3 ways to improve blood pressure. The second goal is by the end of the class, at least 75% of the participants will identify 2 food high and low in sodium. For nutrition management, by the end of the class, all participants will be able to identify food high in carbohydrates and how to count food portion. And the second goal would be that by the end of the class, all participants will be able to name 3 fruits and veggies of different colors. So to assess the short-term goals, I used the teach-back method. And to assess the long-term goals for each class, such as those stated by the Healthy People 2020, it is important to reassess the seniors' health behavior in a few months. Visit the center and hear from them what have changed, how did they do at the doctor office, and possibly see if they were free of any hospitalization that is related to chronic diseases such as hypertension, diabetes, and stroke. And those are pretty much my phases 7 and 8 of the proceed model. And results and conclusion. So weakness of the project, I needed money, and it was time consuming. Problems encountered, there was some disinterest of some participants, and there was language barrier, not all the volunteers that spoke Chinese were there on that day. And then, some participants, they came, they got their incentive, the blood pressure reading, and left. There was a bit of noise because since the room was kind of big, and large group formed, so it was kind of difficult to provide information for 10 people at a time instead of 2 to 3. But overall, it was a good experience doing this project, good participation, and short-term goals achieved. Most seniors had strong desire to learn. And recommendation, education should be done in a private room, limit group to 2 to 3, and have an interpreter, and have more than one educator. And this is my reference page. I appreciate you listening, and thank you so much